As members of parliament start debating the ministerial statement on the status of health service delivery and financing in the country, civil society have raised concerns which lawmakers should pay attention to ensure universal health coverage in the country. Addressing a press conference in Kampala, the civil society group expressed concern about the creation of more health centers in what they termed as political units in disregard to the total number of population in a particular area. Brian Athaide, the advocacy manager PATH Uganda, argued that health centers should be put in place to serve a population of 500,000 people and not less than that.
A health center in every political constituency, a health center 3 in every sub-county, and the upgrade of health center 2s to health center 3s. However, it is of concern that the selection criteria of allocation of hospitals has become more of an entitlement than a need.
Athaide said the creation of districts has become entitlement, leading to creation of more health facilities which are not matched by the health personnel. Issues of concern raised by civil society include underfunding, understaffing, salary disparities between teaching professors and senior consultants who earn 9.1 million shillings and 4.3 million shillings respectively, delayed tabling of national insurance bill before parliament, inadequate vaccine supplies and inadequate ambulances for emergency response, among others. They also pointed out that despite having more centers and hospitals, they are not sufficiently equipped to combat non-communicable diseases, which have become a huge burden to the country.
Are not sufficiently empowered to deal with non-communicable diseases. The Parliament of Uganda has gone ahead to approve a request for a loan of about 1.4 trillion Ugandan shillings.
The civil society criticized Parliament for approving a loan of 1.4 trillion for a private hospital in Lubowa and Makisa district, saying the money should be channeled to complete Mulago Hospital, which only requires 9.6 billion shillings. David Walakira, the budget policy specialist with civil society budget advocacy group, said instead of government loaning money to a private hospital, it should give a loan to purchase vaccine supplies.
Let us lend ourselves money to first buy vaccines, then we can lend someone else money to build for us a very good state-of-the-art hospital, whose accessibility can be discussed with the experience of this new hospital for the women.
Walakira said there's need to focus on health infrastructure development to address gaps in Chirudu and Kawempe hospitals, among others.
So many of us here is that the thought process is, let us focus our resources, complete our health infrastructure development we have as a country. Okay? We are struggling to operationalize Chirudu, Kawempe, Mulago is,
Diana Tibesigwa, Policy and Campaigns Officer at World Vision Uganda, asked members of parliament to scrutinize the budgets of ministries, departments and agencies, whether they are aligned to National Development Plan.
For a long time, we have always made this cry to government that they should align their priorities to the National Development Plan. And you see, like in the middle of the budget process, the minister comes out to read out a statement which actually has not even informed the budget process itself, because we are not seeing some of the minister's statements or issues that came out of the statement being reflected in the National Budget Framework Paper 1920.
The participants had this to say.
And as civil society, we want to speak louder on this and say, although these earmark some progress made, this is not satisfactory. We can do better as a nation concerning that.
We are in the league with South Sudan, who don't have a national health insurance scheme. Even Burundi has, surprisingly. And even Rwanda, that borrowed our ideas, has a coverage of 95%. And it is why we keep on having our best doctors running to Rwanda. Even Kenya now, as it speaks now, they're even piloting the universal health coverage idea.
Report was compiled by Francis Emorut for New Vision TV.